it's only been 1 week since we last took Lily to her appointment. But it was dark when we left. And look how much a week makes. It's pretty much a daylight. This way. Okay, guys. Good girl. Good girl. Heel. No, heel. Good girl. Good girl. Heel. Here we are in Camden. Made good time this morning, even though it was a bit of traffic, but I'm looking forward to this pie shop. Yeah, let's do it. Pretty sure it's on that next block there. Gotta cross over. Yeah, come on. Yeah. This way, chill. Good girl. Good girl. There you go. Yep. Lily, back here. This way. How are you? Hello guys. Sam's going to be very happy because they do takeaway pies. Hello Lily. Hello darling. Hello. Hello. Lily really likes these adventures. Hey, you like these trips, don't you? What do you think? What do you think? Hey, what do you think? Oh yeah, you're happy. Oh yeah, you're happy. So I asked if they do. Oh, Lily. Huh? Hey. Hey. I asked if they do some takeaway pies, so cold pies, and we heat them up in the oven. And she says, yeah, we do. Hello. Hi. Hi there. Hi there. So I got a selection of pies to take home for Sam because she was very jealous when I told her that I found an amazing pie shop. So I'll be very excited to give her a couple of options there to choose from. And I couldn't help myself, I got a whole heap of little treats as well. Good girl, Lily. Well, I couldn't help myself today. I got a coffee, I got a bag full of treats, I got 2 bags full of pies, some cold, some hot. Beautiful little place, that one. Very friendly, we're working there, it looks like it's all homemade. One of the pies was just coming out of the oven out the back. Awesome stuff. Okay, come on. Over this way. Good dogs, this way, come on. Two. Come on, Teal. No. Morning, how are you? That's that textbook 1 bar. What's going on, Teal? You got a good smell there? Tilly, come on. So, Lily seemed to have done really well after the last one. She's just starting her swimming the last couple of days.
Fantastic.
She is a little lazy in the back end with the swimming, so she doesn't quite stretch out as much. I'm quite surprised. Initially, I put a life jacket on her just to make sure she didn't overexert and anything like that. But she's a very competent swimmer. She actually floats very, very well. So she doesn't need the life jacket.
Right.
And I've just been trying to get her to push out those back legs. But
Yeah, sure.
she's a little bit lazy in the swimming.
Has she swum before?
She does. She swims usually in the hotter months.
Yeah, okay.
When I get in, she gets in, but she's not as much of a swimmer as some of our other dogs.
Sure.
But yeah, she seemed to do very well. She's on the supplements that you gave us last week.
Great.
Yeah.
Okay. Not unusual for some dogs to be not as strong in the back legs initially when we start swimming more regularly. They tend to need to develop that hind limb awareness to know that they can use their back legs to be strong through the water. It can be a technique and skill that they'll develop over time.
Yeah.
However, it can also be a restriction of that gracilis as well.
Sure.
That's also a possibility, but hopefully that will improve as that continues with her swimming regime.
Yep.
That's good.
Yeah, so she's getting in daily now, making sure that she gets in.
Yeah, good.
Which is obviously in the warmer months is going to be quite enjoyable.
A bit easier. Yeah.
Yeah.
All right. Will we start with Lily?
Yep. Up on the table.
Yeah.
And so I think this time he mentioned to let me know of some massage techniques to do at home.
So I'll give you both some techniques for breaking up the scarring that's developing through the muscles, but also for relieving a bit of muscle tension that can occur through the back when we start to get those calcifications occurring.
Yep.
So I'll just go through and check and see how she's been this week, see if there's anything that's popped up.
Yeah, she wasn't sure why she wasn't allowed to chase the motorbike that first day coming back.
Unfortunately, sometimes, like clients, for instance, if I've got a dog that's like ball mad, and there's an injury that we need to
all of a sudden there's no ball.
There's no ball.
Yeah.
So they got to hide the balls, and the dogs somehow find the balls and bring the ball right to their feet.
Yeah, we had a dog like that. You didn't even know there was a ball in the house, and he'd find 3 of them.
Yeah.
You know, and he'd just come bring them out and look what I found.
Okay, that's positive. We don't seem to be as reactive through that lower back today.
Oh, good.
When I was palpating through here last week, she was a bit responsive and a bit weak when palpating through this section here. But today she's responding quite well. She's able to tolerate that pressure fairly well.
Yeah, that's good. I have noticed, I remember you said that the lateral movement is not very good for that muscle. And at the time I thought, well, she doesn't really do that much, but I had noticed she was a lot more active in her stick dancing, which as in she grabs a stick and dances in front of me as if to show, hey, look how good this stick is. Which I thought that she must have been feeling better to be able to be that more animated, which was a good sign. She quite enjoys the trip in. Once we get to, we've been stopping in at Camden and go to a cafe for a coffee and get a pie, and she's been loving it.
Where do you park the bus?
Yeah, in a back street somewhere. We've got to walk a few blocks. Yeah, there's no bus friendly parking.
Great, cool. So nothing else that seems to have popped up. Things have been looking pretty good, and good to see that strengthening of the lower back already. That's good.
Yeah.
All right, we'll do a follow-up treatment on that today, and then after that I'll show you some of those massage techniques.
Yep, awesome.
we're seeing a second one today.
Dog?
Yeah.
Yeah, you didn't know?
Oh, it's on for the ride. Yeah.
Yeah, that's why we switched to Wednesday.
Yeah,
So the Tilly is her name.
Okay.
She's a bit older, and she had quite a severe accident before we adopted her,
Right.
and her Achilles heel is tyres, and she attacked a bus tyre and came off second best.
Ah.
So when I think she was about 1 year old, she got run over by a bus.
Ooh.
And we were told that they pretty much had to reconstruct one side of her body. But now she's almost 8,
Yep.
and so she's just got some ailments and some stiff limbs and
Sure.
all sorts of soreness all over her body.
You know, the blue cattle dog when I was growing up, and he was the same. He just
Yeah.
couldn't help himself.
Yeah,
Moving tyre, he was just into it.
they're funny, aren't they?
Cars, quad bikes,
Yeah.
whatever he could.
It's exactly like Tilly. Yeah, she's there's a few things she's not allowed to chase because they're obviously, heavy vehicles, tractors, that kind of stuff.
Yeah.
And every time it goes past, she still looks at it and then looks at me. Am I allowed to attack this one? Even if the quad bike is parked, she'll walk past it, look at me, and I'm like, righto, you can get that one. And then the whole... She loves it. Yummy. Yeah, I did a few dogs that we would potentially like to bring down. But Tilly is probably the most urgent of them. We've got another old boy, a Rottweiler, who has got some issues with his back legs.
Is Tilly on any supplements at the moment?
She's on the CBD oil as well.
Okay. Yep.
And she did have quite a heavy limp on her front leg for a little while. Since going on the CBD oil, she's been a lot better. I actually have started giving her the collagen that we gave to her as well.
The CBD oil's remarkable for inflammation from arthritis. Just remarkable. I've seen dogs that the arthritic changes in, say for instance, an elbow, which is so severe that on X-ray it looks like it's almost fused. and on the outside it's so swollen and so enlarged that it almost looks like it's a cancer.
Mm.
But still arthritic. Put them on the CBD oil, and within a couple of months they're back to walking and
Yeah, right.
not necessarily running, but yeah, it was remarkable to see that she was able to walk and trot and
Yeah.
roll in. It's fantastic. How long was she swimming for?
So I just did about 10 minutes with her, and was just gauging on when she started to get tired. So I would carry her in, release her in slowly, and then let her swim to the side, and then grab her again, walk back to the middle. And then when she started getting a bit lazy, I stopped it there, gave her a rest. She got out, walked around for a couple of minutes, and then another couple of laps. But yeah, once she started just not moving her back legs and swimming her front legs, I thought, well, you're done there. So we'll continue doing that as a daily routine for her. She loves the excitement around the pool, and then when she realises, okay, it's work time, I better go swimming.
Actually got to get in.
Yeah. Because in the background there's 10 other dogs all jumping in and chasing toys and doing all sorts. Yeah. Tilly's a good swimmer. She loves swimming.
Oh, good.
She gets in each day by herself.
I imagine with a coat like that, she's fairly buoyant as well.
She is, yeah. She'll go for a swim and then get out and shake, and her skin's dry. Doesn't get through. Yeah. You have to wash her 3 times just to get down to the skin level. So same again for her, resting after this?
Yes. Yes, same deal. So if she's normally do swimming today, we'll avoid that.
Yeah.
Should be able to swim tomorrow.
Okay.
But, try to avoid the running too much.
Yeah.
Tomorrow.
Okay.
So you can still go for trots and so forth. And
yeah, bushwalk and stuff like that. But
just nothing too fast.
Yeah. So you're pretty busy, booked out. Have you got room for a few more dogs?
Yeah, I mean we're pretty busy, but yeah, there's always. I guess we could always find room for more. It was interesting after you posted your video last week.
Yeah.
Within an hour, I was getting emails from all these wonderful people around the world.
Really? Yeah.
Commenting and everything. It was fantastic. So hello to all you wonderful people out there.
Yeah, that's cool.
And even had a woman up your direction, up towards Newcastle, I think.
Yeah.
She actually called and made an appointment.
Oh, nice. Yeah, we were very impressed with, you know, obviously I mentioned that the vets had said there's nothing we can do. You know, there's no treatment, there's no recommended surgery. It's just ride it out. But, you know, it was good to hear someone say that, yeah, there's definitely some stuff we can manage to slow it down and help it out. So, yeah, it's good. We did that another time with another company we mentioned. I think it was where we got the collars.
Yeah.
And they just got hammered.
Yeah, right.
Yeah, they got all sorts of donations and collars bought and all sorts. Yeah, it was really good. Did you see the video, or you just heard from all the emails you got that it had been posted?
I watched. I didn't sit through and watch the whole thing. I was surprised that you videoed the whole day, like the trip down, and the trip to Kevin and the appointment. It's remarkable how much you actually videoed. But no, it was. I did sit through and watch it. All my boys were very impressed that their father was on YouTube.
Yeah. How old are your boys?
Eldest is 11,
Yeah.
and the youngest is 7. So it's a good age, a fun age.
Yeah, it would be. Mine are a bit younger.
Yeah.
L6, Evie's 4, and little boy Wolf is 1.
Okay.
So still in the
Pretty
sleepless
full
nights
Yeah.
and nappies.
Fun times.
Yeah.
Do your kids get involved with dogs a lot?
Oh yeah. Yeah, the dogs all live in our lounge room.
Yeah, that's awesome.
So
That's great.
the kids are always around them, patting them. The biggest one is to try to stop Wolf giving his dinner to the dogs.
Yeah.
He just wants to share everything. One for you, one for me.
Yeah.
But the dogs are good. They know not to take any food from him. Yeah, so it's a busy house with all the dogs and kids.
And you're on acreage up there?
We are, yeah, we're on about 35 acres.
Yeah.
About 10 to 12 acres of bushland and
Yeah.
about 15 open
Nice.
paddocks. So it's a good good mix for the dogs to experience a whole heap of different things.
Yeah.
Got a couple of magnesium pools and some dams and playground equipment. Yeah, so we were a doggy daycare.
Yeah.
And during COVID, we got shut down for a little while, and we started taking shelter dogs to the farm.
Okay.
And ever since we started that, we just started seeing more and more dogs in need and needing help, and that was about 12 months ago.
Yeah, sure.
And since then, we've gone completely into rehabilitation and of rescue dogs and trying to get rehomed. And we started that journey with 3 dogs, and now we got 20. 15 are ours and 5 are on foster.
Yeah, great. And so the aim is that spend some time with you, kind of debrief, and then they can...
Yeah, so the last 4 that we had were really antisocial.
Yeah.
Abused and neglected, and so they took quite a long rehabilitation process and training and decompress, and now 2 of them are completely unrestricted in with the rest of the pack. One of those has already been rehomed, another one is ready to be rehomed. And yeah, so we're just trying to continue to help some of the dogs that are a little bit misunderstood.
Yeah.
And help them to learn how to socialise properly and behave and conduct themselves, and then be eligible for a home.
Okay. So the massage techniques that we're referring to. There's 2 types of techniques I'd like to show you today.
Okay.
First one is for helping to relieve the tension through her back.
Yep.
Now, the reason we do this is to try and reduce the amount of muscle spasm and tension which can occur just from active play, or if she's running around and she might just twist and strain her back a little bit.
Yeah.
When this occurs, it can affect the way that they position their spine, and which then in turn put more pressure on those areas through her spine which are showing signs of calcification and arthritic changes developing. So the aim of the game is to try and keep the spine as supple and as mobile as possible. So those massage techniques can be helpful to do that.
Yeah.
Particularly when you can't be down here every week.
Yeah.
The idea being is that you can do this sort of thing regularly at home, and it will certainly help to reduce the severity of spinal issues that can occur.
Okay.
So the main thing we're looking at doing is trying to help relax the muscle tissue or paravertebral muscles on either side of the spine. And it's a very simple technique of just using your fingers on one side and your thumb on the other, and just working in circular motions just focusing on the paravertebral muscles
Yeah.
on either side of the spine. So basically it's the soft stuff on either side of the bony bits through the middle.
Yep.
The main areas you want to be focusing on is when we put our thumb through the middle and we focus on where the bony bits are, so the spinous processes, and then you'll find a divot. You'll find a depression behind that before you get to the next spinous process. And these are where the intervertebral discs are located. So if you find these little intervertebral discs, and then we want to just roll your fingers out to the side from there, and that's where we want to be focusing.
Yeah,
Sorry,
sure.
sweetheart, we'll just get you to keep
Stand up,
standing a
darling.
little bit. Yeah, we're almost done. So finding those little depressions, and that's where you want to be focusing on and just working in circular motion.
Right, okay.
We want to be using the flats of your fingers,
Yep.
not the tips.
Right.
That way we're not going to be causing her any discomfort, and that'll help to roll the muscle tissue across your fingers.
Yeah, sure.
So we're trying to just kind of roll the fingers across the muscle tissue to kind of break up any adhesions that may be occurring or spasm that might be happening in that muscle fibre.
Okay.
We can start all the way from the top, all the way up behind the neck if you like. It's a little bit of a different technique through the neck, but through the area from behind the shoulder blades down. It's fairly simple that we can use your finger and thumb on either side. If you have both hands free, you can use more of a butterfly technique where you're putting two thumbs on either side and fingers here, and then working in circular motion with both, which will cover more muscle groups rather than just paravertebrals just on either side. But you will need both hands for that, and for that to occur it's probably easier if she's just lying down. And they really enjoy it. They tend to like it. If you start to get a routine with this, if you're doing it at night and so forth, you'll probably start finding that she'll find you.
So it's time for my massage.
Absolutely.
Cool.
So focusing on the main areas with her behind her rib cage. So finding where her rib cage is, is that last rib, and then follow that line up to where that spine attaches here. So this is the 13th thoracic vertebrae, and then it'll start moving into your lumbars through here. And this is where I want you to focus. So focusing on through here, this is the main area where she has and will have her issues in the future. So this is where we want to be focusing, but you can continue all the way down to her pelvis. The other area I want you to work on is on the gracilis muscle, specifically on the inside of her back legs. Now, this is a different technique than what we were using up here. This is more of a kneading technique. So think of it like we've got like a clump of clay and we're trying to knead it through our fingers. So the idea is we're trying to break up the calcification that's occurring in that muscle tissue. The tendon that attaches the muscle to the inside of her tibia, which is where the gracilis attaches, that's fairly calcified and starting to knot. So you can actually feel like there's little marbly sort of attachments starting to occur. Now these are the areas that we can try and help to break up, but there's a lot of scar tissue there. The aim of this massage technique is trying to reduce the amount of scarring that will develop up that tendon going into the muscle tissue. It's very difficult to break up calcification of the tendon, but where it starts to attach to the muscle, that's the area that we want to be focusing on to try and prevent the calcification developing up higher.
And so you're talking about basically from the inside and staphoid joint there up towards the groin?
That's right. So I mean, if you are comfortable putting that down for a minute, I can actually give you a hands-on position. So I want you to just have your hand through here, and you'll be able to notice, if you just use the flats of your fingers, you'll notice that there's this cord. There's a cord that attaches down here. So this cord, that's the gracilis tendon that attaches to the tibia, and it shouldn't be that obvious. It should be fairly smooth. But you can feel how corded that is. And as it comes up, it'll then attach into the muscle tissue here.
The muscle there,
and then it starts to dissipate.
So is that focal point where it goes into the muscle?
That's where you want to focus.
Now
that calcification does have a tendency of stretching all the way up to the top of the muscle if it's left unchecked. But this is typically where it starts. It goes up.
And so you're just trying to, when you say knead it, because it's right on the inside of her thigh there, are you just trying to sort of just work as best you can without sort of pinching into her?
That's right. So we're still using the flats of our fingers, not the tips. and we're kind of kneading it. So
Yeah,
we're kind of kneading
okay.
it like a piece of
Yeah.
clay.
Yeah, okay.
And it can be
So
fairly
could
firm with
could
that.
be a little uncomfortable for her, that one.
It can be if you're a little bit too firm, but it won't be as soft and relaxing as the spinal one.
Sure.
But we don't want to be using too much force, which is making it painful for her.
Right.
But it's more about keeping this muscle soft and trying to kind of knead those fibres, the muscle fibres, to try and kind of split them and stretch them a little bit. Because it's where those fibres attach with each other. So muscle fibres kind of work as a stretching elongation, and they come together. It's called a striation sort of muscle.
Yeah, sure.
So what's occurring is where they attach and slide, the scarring is starting to develop where these fibres attach to each other, and then it stops them from being able to stretch.
Yeah.
And so what we're doing here is when we're kneading these sort of fibres together, we're trying to stretch, pull them apart, separate them, pull them back, separate them, pull them back. And try and prevent that sort of adhesions from occurring.
Yeah, yeah, sure.
But that sort of technique can be quite helpful in just slowing this health down. It's a fairly common technique used in greyhounds, actually, because it's a very common injury that we see in greyhound injuries for racing greyhounds. Yeah. And it can be career-ending. It's a sort of injury. Yeah. And so it's a technique that a lot of trainers will learn to try and prevent that from occurring.
Okay.
All right, one more thing to do with that. Here we go, Chucky.
You can still see a little bit of tenderness, but nothing like last week.
That's right, yeah, nowhere near as responsive as she was through the whole back last week. Cool.
Very good.
Okay, sweetheart. You done?
Yeah, sorry about that. I gotta say, Tilly's not gonna be much better.
That's all right. Please, Tilly.
Good girl, darling. Yeah, good girl. Good girl. Do you feel good, do you? Eh?
Okay.
Big stretch.
Just
oh, yeah.
Sweetheart.
Tilly's very friendly.
You put your tail and check it out.
You got her?
Yeah. There we are.
So on her last vet visit, they did notice very limited movement on her front carpal joint.
Okay.
But she's always been, ever since we adopted her, she's always been very stiff in the back end, and has always seemed to be looking like she's uncomfortable.
Good girl.
Lily, come on, over here. Good girl, darling.
Good girl. She's not many joints left on these front legs that aren't arthritic. Actually.
Yeah.
So she's got some arthritic changes in her metacarpophalangeal joints. So this is like a knuckles.
Yep.
So it's where their toe structure is very similar to us actually. If we look at our fingers as a model of their toes, we have our knuckle is like their metacarpophalangeal joint, this one here. Then we have the proximal joint of the toe there, which is this one that sticks up there. And then they have the distal joint here, just above the nail, which is just behind the nail, almost where it touches the pad in the back of the foot. With her, she's got some arthritic changes that have developed from previous injuries she's had in these toes. It may be from the injury or from the accident, but more than likely it's probably more from her just being a lunatic. Through her life. And they run around twisting, turning, change direction really fast. She's also quite upright on her pasterns. So she's quite straight through here. Whereas, say for instance, Lily and Shepherd, they're quite low on their pasterns. And they can kind of work like a suspension or a shock absorber. And if they're fairly straight, it does put a lot of pressure on those metacarpophalangeal joints. So we've got some arthritic changes developing in these toes. She's got limited movement in this outside toe. It's uncomfortable when I do that. As you can see how she was kind of licking me to kind of say, please stop that. And these two in the middle are probably worse. Got some swelling in this one here and that one there. One on the right, not as bad. This one's not too bad. This one here is a little bit reactive, but still flexibility is pretty good. The outside toe still seems to be restricting movement. And if we look at her pad, or sorry, not pad, her foot, when she takes the weight off it, you can actually see there's quite a bit of swelling through here, whereas that should be fairly smooth through there, fairly flat. Going through to her wrists or carpus joints, yes, you're right, there does seem to be a restriction of flexibility. One on the left isn't too bad, but we still should be able to get her pads to come up and touch the back of her forearm. Most dogs should be able to do that. But she's got limited flexibility on this one. On the right one, it's a bit worse. She can't even get back to 90 degrees. So I'm presuming this is the one that was the main concern on that wrist. Going into the elbow joints, both elbow joints seem to be showing evidence of arthritis. Fortunately, there's still got pretty good flexibility in that joint. I should be able to touch this wrist up to her shoulder joint, but I can only get it to about there, so that's about 90% flexion. Extension doesn't seem to be too bad. I can get pretty good extension on that. But when I palpate in the back of the joint, she does react and tends to take the weight off it. The left one isn't too bad. The right one seems to be the one that's causing her more discomfort. So when I do that same test on the back of the elbow, just by squeezing my thumb on the back of the bursa capsule, she lifts it immediately. And there does seem to be a restriction of flexibility. I can get it to about there. Extension, again, not too bad. Not too bad. But the geometrical changes on these elbows is significant. Meaning that the shape of it's changed and altering. Shoulders don't seem to be too bad. Not huge amount of discomfort in either of those joints. It seems to be more in the lower joints. Going through spine, let's see what we've got. Good girl. Hesitant on hip extension.
It's where you could visibly see she was short stroking and very stiff through the back.
There's a on this one too, and there's also, when I do so, there's crepitus. So when I take that joint through its range of motion,
Yeah.
you can actually feel the clicking.
Yeah, right, okay. And is it her knee or hip?
Well, let's find out. Normally, restriction of extension is due to hips or lower back.
Yeah.
Sometimes it can be the stifle joints, but in this case, I think it seems to be the hip. Restriction of flexion on her stifle joint as well. Again, I should be able to get her ankle or tarsus joint all the way back to touch the back of her pelvis.
Right.
I can only get it about 90%.
Yeah,
and that's
sure.
That's a physical obstruction. It won't go any further.
Yeah, okay.
It's not because it's uncomfortable. It just won't go any further.
Yeah.
Cruciate ligament seems stable. Bit of an arthritic joint on that outside toe, but it's pretty stable. Good gal. Being very tolerant, darling. So you can see the flexibility on her left side. I can get that joint all the way up on this side. No issues, no signs of pain or discomfort. Interesting to note also is when I rotate the stifle joint,
Yeah.
where the tibia meets the femur, you can see there's a
moves
certain level
quite a
of
bit.
flexibility.
Yeah.
So that's a good sign that the meniscus, the cruciate ligament, and the medial and collateral ligaments are all fairly functional. And we compare that to the other side. Problematic joint. There's not much movement there.
Right.
So again, indicating that there's probably a pretty decent injury in that stifle.
Yeah.
Or has been in the past. And we're starting to see calcification in it.
Yeah. Which matches that side of her body.
Yeah. Yeah. Okay. All right. So a few things going on there, but mostly more arthritic conditions within the joints of the body. Going through and checking her spine, she doesn't seem to be showing too much signs of discomfort, but there does seem to be areas we'll just probably want to keep an eye on going forward in the future. But considering what she's been through, the spine's in relatively good condition.
Okay. She's tough as nails, this dog.
Yeah.
She doesn't complain much at all. I actually feel really bad the way you were picking up all those issues with the front legs. She's only just had a vet screening and they just came up with that front right carpal joint and said, oh, it's a bit stiff, maybe we should look at that. But you got to look at it and you're like, this and this. So the poor thing, she should have been on pain meds by the sound of it.
Not necessarily. So I guess different levels of discomfort can occur from arthritis. If we put them into three categories, so mild, moderate, severe, most of those issues she's got going on there I'd probably still keep at this stage in the moderate pile. Probably not getting into the severe stage yet. Yeah. And if we can avoid the anti-inflammatories for as long as we can, the better.
Yeah, right.
It's helpful to have that when we're getting to those later stages where nothing else is working. Okay. So CBD oil is, in my opinion, one of the strongest options for treating inflammation, on a natural level. And it has very little effects on the rest of the organs of the body. When they get older, that can affect the liver enzymes a little bit. It can elevate the liver enzymes just slightly, right? But not enough to be a concern. And doesn't seem to escalate. So say, for instance, if you're on anti-inflammatories for a really long period of time, the concern is the liver gets overloaded and then it can't process it, and then it starts to show signs of stress.
Right.
And then we start seeing liver enzymes elevating in the bloods, and that's when you have to take them off the anti-inflammatories.
Right. Okay.
And then where do you go from there?
Yeah, exactly.
So the idea is to try and keep those anti-inflammatories for when she really needs it,
Yeah.
when she gets older.
Yeah.
For now, she's doing quite well on the CBD oil.
Okay.
From the state of these arthritic joints in the front, she should be lame as
Yeah,
as a cat. But
yeah.
the CBD oil and what you guys are doing with her at home seems to be helping a lot. What I would suggest though is adding some joint supplements.
Mm-hmm.
So the collagen can be helpful,
Yeah.
but I'd also probably suggest getting her onto a good quality glucosamine sulfate supplement.
Mm-hmm.
So something with glucosamine sulfate, chondroitin and MSM, all three are really good for giving the joints of the body the building blocks it needs to regenerate cartilage tissue.
Yeah.
At this stage in the progression of the arthritis in those joints, there still is good evidence of some cartilage still evident.
Yeah.
So when there's cartilage still evident, then it's still able to respond to the glucosamine sulfate, chondroitin, and the MSM.
Mm-hmm.
When we get into the severe stages of arthritis, when we're getting to the point where it's just bone on bone and there's no cartilage left,
Yeah.
then we find that those supplements don't do anything because
Yeah.
there's no cartilage left for it to react with.
Yeah, sure.
And that's when you have to step for your anti-inflammatory and so forth.
Okay.
But for now, there's still evidence of movement in those joints, so certainly some evidence of plenty of cartilage left, so we'll try and preserve that as best we can.
Yeah,
so
sure.
the collagen can be helpful, but I'd also be adding glucosamine sulfate,
Yep.
not glucosamine hydrochloride,
Yeah.
glucosamine sulfate.
Do you sell it here?
I do have some here,
Yeah.
yeah. Actually, there is a good formula which has the collagen and those other things
Okay.
in the same powder,
Yeah.
if that makes it easier. Alternatively, it can come in a tablet form, whatever's easiest for her. But suggest getting her onto that as well.
Mm-hmm.
We'll give her some treatment today while we're here. But the main thing with these sorts of conditions is the management, and
Yeah.
you're pretty much already onto that.
Yeah.
Obviously, trying to avoid jumping down from objects is going to
Yeah,
be the main
yep.
irritant for those front legs. Obviously, attacking tyres,
Yeah.
getting caught underneath moving wheels isn't ideal
Yeah,
either.
that's not a good one, is it?
But it's hard to stop. It should be more comfortable lying down. Or should be okay standing.
Potentially, she could. Do you want me to?
Well, I might just offer her a mat and then see if she can be more comfortable lying down on the mat. So
On the table still?
Yeah. So pop this down.
Good girl.
Give her the opportunity to lie down if she wishes to.
Can you drop? Lay down, darling. Drop. Chill. Drop. There we go. Start to relax.
Just give her a bit of a
Yeah, give her a bit of a help.
encouragement.
Good girl. There we go. That's it. Good job, darling.
Good girl. What was that? What was that, eh? You felt that one? Good girl.
Lily. Don't worry about that, darling. Good girl. Good girl.
Start with the dodgy side. Have a look, Chucky. Have a sniff. Okay. What dosage of the oil is she getting?
So she is getting the same as Lily, so a full mil once a day. Also got another dog of mine, the Rottweiler, he's on it as well. Just because as soon as I put Tilly on it, the limp disappeared, which was quite impressive. So she stayed on it, and now Fredo's on it. But got to try and keep sourcing it.
Yeah.
It's hard to come across. It's not cheap either.
Not cheap, no. This stuff is not cheap.
Stay there.
Once I've finished building my house, I'll start to put together some videos.
Looks like a good project.
Yeah, it's taking up a lot of headspace actually.
Yeah.
So, once that's done, then I'll be able to focus a little bit more on just some extracurricular stuff, a little bit of work, and just some information videos. I think they'd be helpful to just try and
to put online.
Yeah, yes, on YouTube and so forth.
Have you got a YouTube channel?
Not yet, but it's something my son's been pestering me about and telling me that I should. But yeah, it's just something I'd like to do, just to try and get some more education out there about not only health issues, health concerns that can affect various breeds, but also just techniques that people can do on checking their own dogs at home. And checking them out on a regular basis rather than having to wait till you get to the vet. And a lot of dogs don't respond very well in a vet environment. They're really anxious, they get really tense, and so it's hard to see those subtleties to show signs of discomfort and pain. Whereas at home they'll be more relaxed and more comfortable with their owners looking over them, and so they give them the techniques and the skills to be able to look for things themselves at home. And I think that could be beneficial.
Definitely, I think it would definitely benefit a lot of dogs. You know, it's a similar sort of thing that we went down with, trying to just give tips and tricks to build the relationship with the dogs as far as training goes and all that kind of stuff. And you know, we've had quite a few people email us and say, you know, I was always you know, would never have got a rescue dog, but after watching your videos, you know, I've went and got this rescue dog.
Yeah,
it's
great.
amazing. You
That's
know,
cool.
I do all the training, and it's that they just think it's such a rewarding, you know, event that they just would never have considered a dog like that before.
For sure.
So yeah, I definitely believe in putting the information out there, and it does help.
That's what we were investigating. That's good. We'll need to get a standing.
Up again, darling. Good girl. There you go.
Okay, possum. All the way to the top. Just light that off. Good girl. Good girl. Here we go, sweetheart. Pop it down. There we go.
How's that, honey? How's that, darling? So Tilly, same deal. Keep her quiet.
Yeah, keep it quiet if we can. Again, trying to avoid that jumping down of objects.
Yeah.
A little bit trigger. When we're checking arthritic joints like Till's, because I'm having to test the joints, they can make them a little bit stiff.
Right.
After the next 24 hours, but it should settle down after that, and then the treatment should start to take effect.
Yeah.
But with Till's sort of condition, this is more of a management thing on a day-to-day sort of basis, which is going to win the war in the management.
Yeah.
And what you do with the swimming and the exercise at home, and the CBD oil, and potentially getting on to glucosamine supplement.
Yep.
Sulfate supplement.
Yeah, I'll definitely grab
and that's something worthwhile.
that off you today if you've got it.
Sure. Cool. Any other questions at this stage?
No, I'm just glad that we could identify a little bit further what's going on. Hey, darling. How you feel, Tutu? You feel good? You look good. You look bouncy. Hey? How about you, Lil? Yeah, good girl. Hello. Hey. Good dogs. Good girl. Good girl. Okay, come on. Lily's jumped straight into my seat. Sorry, Tilly's jumped straight into my seat. Lily, what you doing, darling? You want to get in a cage again? Lily's all about comfort. She wants to lay in a bed. take that lead off for you, huh? Oh, yeah, you want to lie down. Okay, there you go. I think I have to sit there. Take me home, driver. Good girl, Till. Right, I'm going to have to pick you up there. Oh, look at this. This is very exciting. Yum. We've also got pie for the road. Come here, Till. Oh, good girl. Let me take that lead off for you. Well, that was very, very good, especially for Tilly. He's very thorough and very very accurate with his diagnoses. So not only, like, we knew that Tilly had some stiffness and limited movement in her front right wrist or carpal joint, and not only did he see that as quite obvious, but then further down into Tilly's feet and knuckles, he was accurately identifying which knuckles were more affected. So it was a very thorough examination, and I suppose that's the difference between, as Neil said last week, vets have to know a lot of stuff, and so they have a very broad knowledge of the ins and outs of a huge range of animals, whereas Neil, as he said, is lucky enough to be able to specialise in the musculoskeletal system, and so therefore I was very impressed with how quickly and accurately he could diagnose all the different joints and all the different muscles, and so I do feel a little bit bad for Tilly that she is in such a bad way as far as her arthritis and all the joints and ligaments. But the positive thing is that now we've got her on the right supplements for her, and it was also interesting to hear about the anti-inflammatories, where I know quite a few dogs that holiday with us and they are on continuous anti-inflammatories, but as they get older, he was saying it does play a bit of havoc on the liver and liver enzymes, and getting into the blood, and then therefore causing other issues. So it's not a solution long term, and so therefore putting Tilly on some of this other medication to help with her cartilage and movement will prolong the injuries, the slow down the progress of the injuries and prolong her movement in those joints. So again, very impressed with Neil's treatments and assessments and knowledge, and he did mention that he was looking at starting a YouTube channel where he would give this knowledge out for free to try to help dogs at home from early identification for some of these things, instead of people going unknowingly. So having the ability to share that knowledge with everyone, I think, will be hugely beneficial. I really look forward to when he does start a YouTube channel. We'll definitely let everyone know from our followers to start following him to get all that vital information. So stand by. He's got a lot going on, but it is on his to-do list. So not sure when it will be, but as soon as it is, we'll stay in contact and we'll let everyone know. Rightio, guys. Let's hit the road. G'day, guys. Just wanted to say I just had a lamb and rosemary pie. It was amazing. I don't usually enjoy pies that much. However, I can really see why Sam loves pies if these are the pies she's talking about. Now, I'm very excited about eating some of those sweets that I did get on the way home. we're on the road, we're heading north, we're just about to jump back on the highway, and we're about 2 hours from the farm. So Tilly, Lily have both had their treatments. They both did very well. We're much more aware of exactly what's going on with Tilly now. It does seem like, you know, her injuries from a young dog when she was run over by a bus are coming back to haunt her now as an older dog. So managing her through her older years and, you know, limiting how much we allow her to be a crazy red cattle dog. But the main thing is obviously jumping off things, jumping down things, downstairs, out of cars, that kind of stuff. Luckily we don't have any of those scenarios for us. We got ramps for the pools. We're a low level house, we're not a 2-story house, so there's no stairs. So those things are really good. But for anyone else out there, that is often a big issue for dogs as they get older, is jumping off things. One of the things that I've been watching and realizing that I will have to start training him not to do anymore is, as Roscoe gets older, we're going to have to stop him from jumping out the side of the pool the way that he does, because that will be something that will come back to haunt him when he becomes an older dog. So very happy with their treatment, well worth the drive. Again, if you do have a dog that has some sort of ailments and you're not sure, you're not getting the right answers from wherever you've been going, I do recommend booking in with Neil, and you will be impressed with just how knowledgeable and how easy he picks up the injuries. Righto guys, I'm on the road. We'll chat to you again soon at the farm.